So we will start off then with the bill from Chair Noor. Chair Noor, so glad to have you with us today. I'm going to ask Representative Katiza Watoon if you would move to bring House File 466 before the committee.
Mr. Chair, I would move House File 466.
Thank you. Chair Noor, welcome to you, sir. You have there's a DE3 before us. Would you like to have that that moved as well, Chair Noor?
Good morning, Mr. Chair. Yes, I would like to move the DE3, Mr. Chair.
Okay, great. And so Representative Katiza Watoon, if you'd be willing to move that as well.
Mr. Chair, I would move the DE3 amendment on House File 466.
Thank you. Yeah. And so members, any discussion on that? I think this is essentially the bill we're going to be hearing from the author. So no discussion to that. So all in favor of the motion to adopt the DE3 amendment to House File 466, please say aye. Aye. Any opposed? Okay. That motion passes, and the bill is in the form the author wishes. And so, Chair Noor, welcome to our committee. So glad to have you here, and please begin presentation of your bill.
Thank you, Mr. Chair and members. This is a great day when we talk about the bill that is before us. House File 466, as amended, Mr. Chair and members, does simple stuff that will make the work for the workers and the county and the recipient much easy for them to receive benefits. Mr. Chair, this bill repeals the Diversionary Work Program, or known as DWP. 20 years ago, when this program was created as a parallel program with the MFIP program, Minnesota Family Investment Program, this was created to be a stopgap process for only 4 months so that we can provide intensive employment program for the individual. Guess what? After 20 years, there's nothing that has changed, meaning that most of the individuals who go through the DWP program will end up in MFIP in one way or the other within 12 months. So what we essentially created, we created more burden, we created more work for the staff, we created a system that does not work for anyone other than just being there to create more confusion, create more errors, create more administrative burden. Mr. Chair and members, this is now an attempt to simplify. When an individual or participant walks through the door and apply for a program for cash assistance by creating one cash assistance program that is MFIP. Quite frankly, if you look at the results, for many who have looked through the data over the last few years, DWP has not yielded the results. It has created more stress, and we're trying to make sure that we can repeal a program that is not essentially needed at this point. I was working for the county when this program was initiated, and quite frankly, many people were confused. The complexity in the programs that we're talking about, from MFIP to DWP to SNAP program to healthcare, makes it really complex and also creates the churning of the people who are off the program because we are not helping those who needed the help. Mr. Chair and members, this bill also removes some of the other barriers. For example, we are removing the hardship that is created by sanctions. Let me give an example. If an individual is to receive a hardship extension, MFIP is for 60-month time limit. But what we essentially created is if you are in sanction in the last month of your 60th month in MFIP program, essentially you are completely disqualified from the program, unless you do have a good cause that you should not be in a sanction. Members, if there's a hardship, whether it's a mental illness, whether it's a barrier to get employment, whether you've got someone who's sick at home, this does not help. Likewise, we have also reduced the time frame an individual can receive benefits when it comes to the hardship extension, when we essentially created a barrier in saying that if you have not been in sanction in the last 10 months within the 12 months. We're increasing the complexity of the program and how it was designed to work. So this bill removes those complexities. Mr. Chair and members, I'm glad to inform you that we are also removing the retrospective budgeting Essentially, what we do is we look at the income, which it's called the income month, and then we have the budget month, and then we have the benefit month. Essentially, we're looking 2 months of your income to determine the benefit you're going to be receiving next month. So this bill will move us into prospective budgeting, which requires us to anticipate the income of the individual looking forward. Guess what? When you come in and apply for MFIP, what we do is we use prospective budgeting for the first 2 months, and then we go back into retrospective budgeting. It doesn't make any sense. And we are one of the only states that uses retrospective budgeting. So this bill today is essentially removing that burden and creating a fair system whereby we're using anticipated income for that individual so that we can have a continuous program for those individuals who are receiving the benefits. Likewise, in this bill, Mr. Chair and members, I'm excited to inform you that we are also creating a 6-month reporting process, meaning that instead of doing a monthly reporting, we're going to be asking individuals to report every 6 months because we know changes happen. We know things will change. But when we put that burden, I'm showing you this is when you walk in. This is a booklet that individuals receive just to apply for the program. None of us are going to go through this when you're in crisis. It's really difficult because we're making it harder for everybody, including the workers. When I worked at the county, I used to have more than 300 cases to process. Can you imagine 300 cases that everyone has to receive a household report form on a monthly basis? They have to inform me how much income they're getting, if there's any kind of change that has happened in the last 30 days. That creates a burden not only for the family, but also for the workers because you have to process each and every case. Guess what? If you didn't process that case by the 16th of the month, the family will get a letter telling them that they will receive a stop of benefits. And most of the time, we have to go back and reinstate a case within 30 days to continue the benefits. We essentially created another hardship in that process. Today is a good day when we're creating a program that is more functional, more simplified, and also aligned with the other programs such as SNAP in terms of reporting and also healthcare to make sure that we've got a streamlined process so we can serve the participants in the program. It's a big bill, but with good ideas to move us forward. Mr. Chair, I have good testifiers with me who will help us go through the process.
Thank you so much, Chair Noor. And before we do that, I'm going to ask House Research to confirm. I believe that everything in this bill is in the governor's budget, but perhaps a portion. And Ms. Pinelli, if you wouldn't mind just clarifying for us which portion of this is in the governor's budget, if you know.
Mr. Chair, members, my understanding is the two pieces that are part of the governor's budget is the 6-month reporting and the prospective budgeting.
Okay. Thank you so much, Ms. Pinelli. And then as I turn to testifiers, we're pretty tight on time, so I think you've all been told to limit your remarks to 2 minutes, and I'll be pretty strict about that. And so, Ms. Webster, we'll start with you. Please identify yourself and proceed.
Thank you, Mr. Chair, members. My name is Jessica Webster. I'm a staff attorney with Legal Aid. I use she, her pronouns, and I've worked with the Minnesota Family Investment Program for about 16 years. I want to thank Chair Noor for bringing this bill for this good day and really for the wealth of expertise in MFIP that he brings to this legislation and to the conversation. So when I talk about MFIP, I remind people of two things. One, everyone accessing MFIP has children. At its core, this is a children's anti-poverty program. We like to talk a lot about the adults in this program, but really this program is about kids. And to that point, in your packet, I believe the Children's Defense Fund provided profiles for every district in terms of who is accessing, the children that are accessing MFIP in your districts. The second thing that maybe doesn't need to be stated today is that MFIP is one of the most arcane and complicated programs run by the state of Minnesota. Some of that complexity comes from federal laws and regs, but much of that unneeded complexity comes from decades of really well-intentioned state decision-making. Some states have a few pages of statutes. Minnesota has hundreds and hundreds of pages of statute in this program. And so when you want to make a little simplification, as you see in this amendment, it can lead to 49 pages. So it is a complex program. And to the bill, it's a really first important step in simplification. I sometimes talk about MFIP as a tangled ball of yarn, and we ask counties and parents to untangle this ball of yarn and knit something beautiful at the same time, and that's really difficult. So I really appreciate every effort to simplify where we can. Chair Knorr already talked about the simplifications in this bill. I really see them in 3 buckets: the budgeting and reporting bucket, the DWP bucket, which I think the counties will talk about later, and then the sanctions and financial penalties bucket. That last bucket is the way that we sanction families right now. We have one of the steepest penalty schemes in the country. Some families face a $300 penalty when they make a mistake in the program. So this also addresses that.
And
With that, we have other
wrap up.
testifiers, and
Yeah.
I will wrap up. Thank you, Mr. Chair.
Thank you so much, Ms. Webster. Thanks for all of your work, and I suspect we may need you to answer questions, so please stick around. Yeah, Commissioner Lundy, come on up, and after you will be Alana Gravitz. But please, Commissioner, as you get settled in, once you do, please identify yourself and proceed with your testimony.
Good morning, Chair and committee members. Thank you for having me today. My name is Jeff Lundy, representing District 1 at Hennepin County Board of Commissioners. Hennepin County is grateful to Representative Knorr for carrying House File 466 to simplify income reporting requirements for families on MFIB, allowing county staff to more efficiently serve our residents while reducing administrative burden. Changing the income verification from monthly to every 6 months will allow families to focus on finding new work, finishing school, and completing a training program, knowing that they will have the support they need. This change will also benefit counties by reducing the amount of staff time required to process monthly reports. This bill will also allow Hennepin County to better serve families in need of cash assistance by serving all families through MFIB rather than DWP. DWP was originally created to divert families away from MFIB, but data has shown that the program does not work. Less than 10% of Hennepin County families successfully complete DWP, and the vast majority move on to MFIB. MFIB provides the same benefits and support as DWP, so having 2 programs that share the same goal as stabilizing families, yet are administrated differently, requires separate applications and additional staff time to work with families, an example of unnecessary government bureaucracy and complexity. This bill is a common sense approach to supporting working families while also simplifying the administrative burden for both families and county staff. Simply, time is money, and the more time that we spend on processing stuff takes away from the time that we can spend on helping people move out of crisis and instability. So with that, I would like to thank you for your time today and your attention. Thanks.
Commissioner, thanks for your work and your public service, and glad to have you here. We've got Alana Gravitz up next, and then it'll be Tina Rucci after that. And so as you get settled in, please identify yourself and proceed.
Chair Pinto and members of the committee, my name is Alana Gravitz, and I'm a manager in Hennepin County Economic Supports. Together with a colleague from Beltrami County, I co-chaired the MAXA work group on the Diversionary Work Program. I'm glad to be here in support of this bill today and to speak specifically to the DWP portion. When families apply for cash assistance, counties are required to determine their eligibility for either MFIP or DWP based on specific rules, such as if the family has been on cash assistance in the past 12 months. The eligibility criteria for the 2 programs is the same, and the majority of people who are assigned to DWP do end up using MFIP as well. So this bill eliminates complexity and creates one comprehensive program that works for all residents by having all families start with MFIP. DWP is a 4-month program. This is not enough time for most families to stabilize, which is why the vast majority end up using at least a few months of MFIP. Let's think for a minute about the realities of a program that expects families with very low income to stabilize in just 4 months. As you well know, a large portion of Minnesota is a childcare desert. 4 months is not enough time to find childcare. A large portion of Minnesota does not have reliable mass transit, leaving many residents without enough time to secure transportation. If a family only needed 4 months of cash assistance, that's fine, but most need a little more. So why would we put a barrier in front of them and have them go through the whole application and interview process all over again? The application and interview process is also time-intensive for counties, so this system of repeated application is draining resources without adding value for the public. Our policy goal is for families to become self-sufficient, not to provide an unrealistic timeline and create rework for them and for the county staff who serve them. Serving all families through MFIP leverages all the supports that MFIP has to offer while providing families the time they need to increase their economic stability. Thank you.
Thank you so much. Thanks for your work, and thanks for being here. Tina Rucci, you're up next, and then Megan Jeckett will be up after that. So yeah, please identify yourself once you settle in, and proceed.
Good morning, Mr. Chair and committee members. I'm Tina Rucci, Advocacy Manager at Greater Twin Cities United Way. It's a pleasure to be here today and testify in support of House File 466. At Greater Twin Cities United Way, our mission is to unite changemakers, advocate for social good, and develop solutions to address the challenges no one can solve alone. Last year, we touched over 500,000 lives across the 9-county metro area and funded over 100 service organizations and coalitions that do amazing work every day to support our communities. Organizations like St. Paul Promise Neighborhood, one of our highly valued nonprofit partners who will be testifying after me. Together, we are working to advance pathways toward economic independence for working families from low-wealth households. Addressing the benefits cliff was elevated as a top priority by our nonprofit partners who see it as a primary barrier to increasing family income and achieving financial stability. The benefits cliff occurs when a public benefit program quickly tapers off or phases out completely, resulting from a small increase in earnings. This small gain in income, coupled with a sudden loss of benefits, ultimately causes families to backslide financially. With the current demand for workers, it is important to support pathways toward better jobs, better wages, and increased hours, rather than penalizing people for taking advantage of employment advancement opportunities. Short-term public benefits like MFIP can help families get back on their feet to pay for housing, food, childcare after a temporary job loss or crisis. House File 466 will help stabilize benefits, allowing workers to pursue the education, training, and career support needed to expand their capacity for higher wage employment. It would eliminate unnecessary administrative burdens that cause barriers to families, and it would align reporting requirements with the federal SNAP program for strong quality control measures. Small changes to MFIP budgeting periods will reduce barriers and encourage a thriving workforce, a thriving economy, and most importantly, thriving families. Thank you, Representative Knorr, for your support on this issue, and to the committee members for your time today.
Thank you so much, Ms. Rucci, and come on up, Megan Jeckett. I should note as a constituent of mine, so I'm especially glad to have her here. And once you get settled in, please identify yourself and proceed.
Okay. Chair Pinto and members of the committee, my name is Megan Jeckett, and I work at the St. Paul Promise neighborhood. For over 10 years, SPPN has worked to promote racial and economic justice so every child in St. Paul can live a great life, pursue the career of their choice, and build wealth for their family. Today, I am testifying in support of House File 466 by sharing a story from one of our families in the neighborhood. This parent recently participated in our 6-month People's Fellowship to learn financial literacy and chart a path to building wealth and assets for the future. This parent plans to attend Normandale Community College, pursue a degree in business administration, receive her realtor's license, and ultimately start her own business. She currently works at Amazon, but has recently had to cut back her hours to have time to move her education and career plans into action, all while still caring for her 3-year-old son. She's turned to MFIP for support, hoping the program will help her fill in the gaps to make ends meet as she works to build a better future for her family. Yet, her income and MFIP benefit have fluctuated through this life transition. The turmoil of being unable to predict her monthly income has been stressful and honestly quite disincentivizing. She is working to become more financially independent, yet feels penalized for doing so given the repercussions under the current system. Her story is one of many we hear from families working towards building a brighter future. Please consider House File 466 a strong foundation for families to climb higher. Thank you.
Thank you so much, Ms. Jeckett. Thanks for all of your work. Are there any members of the public who wish to testify on the bill? And I should note the plan is to lay it over today for possible inclusion in a budget bill. Okay, so then seeing none, then we'll move on to member discussion questions. Members, Representative Zalesnikar, we'll start with you.
Thank you, Chair Pinto, and thank you, Representative Knorr. I just had a question. I understand this bill, and I just have questions surrounding the 24 operation settings, because there's many of them, and many workers are working in settings like that, like assisted livings and nursing homes. And so one of the things when I'm looking at this, I just have a question, and Chair Noor, or Representative Noor, you probably know the answer to this. But with MFIB, it's 60 months. Understand that. It's for the child care, and the worker is either looking for work or going to school, which makes great sense to me. I guess one of the questions I'm wondering is how do we, it says in here on one of the pages that employers, it talks about employers verifying employment, like reasons that delays have happened for counties because the employer didn't verify employment, and I can understand that too. With the employer verification, beyond that first step of I'm an employer, you're an employer, this person works for me, and that you submit the paperwork, what systems are in place to let the county agency know what the payroll's been, or the call-ins, call-outs? We call them call-ins, call-outs, and 24-hour break. It doesn't matter if it's for PTO or it could be FML, it could be anything, but to allow the county to know what the person is on for payroll. Is there can you explain to me the system we have that tracks that?
Chair Noor.
Thank you, Mr. Chair, Representative Zalesnikar. For anyone who's receiving MFIP, they're required to produce their pay stub, the copy of their pay stub, so that the worker can actually process that. So that's why I said we have to look back retrospectively on that income. There isn't any system at this point that can actually track every employer so that the system can update that information. But likewise, I think we do have periodic systems that are created for when employers report to deed, that information is shared, so that information is also passed to the worker so they can see if there's any discrepancy in place. Likewise, I think I do have another bill that will also simplify using the work number in order to verify employment information for those who are participating through that process.
Thank you, Representative Noor. And I would support that. I think a number makes more sense, like we do medical record numbers and we do tracking, numbers to know so that we can help a person. Because one of the concerns I've had, and I've shared it at other committees, is that as we increase benefits, regardless of what system it is, and we have to fill shifts, this for the group of workers that are on MFIB, they are not picking up shifts. So if they only can work 2 shifts a pay period or a week, that's 2 shifts. And so as we've increased the wages, we are capped at an amount of money. And so, I totally support, the program. I want to make sure we have a pathway to full independence for a person to reach their highest potential as fast as possible. And with the number of nursing homes and assisted livings that have shifts open, I mean, we have so much employment opportunity for people, for pathways for teaching and nursing, and the list goes on and on. I want to make sure people aren't penalized, that we have an opportunity for them to meaningfully save some money and then get a pathway back to full independence, because I don't want them to be penalized where that's not going to happen, because we're going to have facilities close because many of the workers are on MFIB.
Could I ask you to if you can focus on getting to a question or
Is that part being addressed as far as the number of shifts an employee can actually work to be eligible as we've increased raises?
Okay. Chair Noor, or thank you, Representative Zalesnikar. Chair Noor.
Thank you, Mr. Chair. I think the 6 months reporting will simplify the process so there's no burden to the workers so they can focus on their employment. The intent of MFIP is for self-sufficiency. And we understand that many individuals just use a couple of months within 12 months. So this is a great initiative to make sure that there's no burden on the worker, and also there's no burden on the families so that they can focus on the employment and become more self-sufficient.
Representative Zalesnikar, final question?
No, thank you very much.
Thank you. Representative Hansen, up next.
Thank you, Chair, and thank you, Chair Noor, for bringing this bill forward. We've talked a lot about how do we help our workforce right now, And this is one of the ways. The folks that are providing these services at the counties have so much on their plate with so much extra paperwork. And so I can just hear all my friends so excited about 6-month renewals right now. And so I just wanted to express my gratitude for that and for really thinking about the changes we need to make holistically, that it isn't just one solution, that all of us are bringing forward bills that are going to make such a huge impact for kids and families. So thank you, Chair Knorr.
Representative Hicks, you're up next.
Thank you, Chair. So I will be really brief. Thank you, Chair Knorr, for bringing this. I do want to just say, I hear all the time that these benefits punish people for picking up shifts and they punish people for working, and it's simply not true. They showed us the chart that shows the difference. What is true, however, is that workers don't understand how their benefits interact with work. Bridge to Benefits is a wonderful program that many of our workers work through with folks to help them understand, but it is complicated. We have sat in this room and listened to all of those presentations, and you all heard how complicated it is. And so it's not that we punish people for working. These programs actually don't. You can continue to earn your INFIP up to a much higher amount than the cash benefit you're getting. You can keep your child care assistance up to a much higher amount. But what is missing is folks understanding how work and benefits work together to bridge to self-sufficiency. And I think if our workers aren't processing 300 renewals every month and instead are processing 6-month renewals, they might have more time to do some of that counseling to help people understand. And if anybody ever wants to sit down, it's been a long time since I did that math on a whiteboard, but I think I could probably still do it in a pinch. And I'm happy to show people how to do it. But we have to educate folks about the bridge to benefits and how we work towards self-sufficiency so that they are empowered to make those decisions.
Thank you. Thank you, Representative Hicks. Representative Hudson. Yeah.
Thank you, Mr. Chair. Just a quick question. Can you give me a thumbnail sketch of how the prospective budgeting works? Like, what does that look like? Obviously, looking back, you're going to be looking at payroll. You're going to be looking at pay stubs. Is it just a guess of what's going to happen in the future? Is there any checking to see if the prospective budget was accurate after the fact?
Chair Knorr or testifier.
Thank you, Mr. Chair. I'd like to ask my colleague to actually walk us through the prospective budgeting.
Thank you. Yeah, Ms. Webster, please.
Mr. Chair, I could walk through it clumsily, but I think it'd be better if the department walked through it.
Okay, if we have somebody else who can give a more precise answer or less clumsy answer in response to Representative Hudson's
Representative
question,
Hudson has-
that'd be most helpful. Yeah, and once you settle into your chair, you can identify yourself, please, and then proceed with your testimony.
Sure. Ryan Johnson, Minnesota Department of Human Services, Representative Pinto, and Representative. So prospective budgeting looks at income over the last 30 days and then any anticipated income over the budget period. So in this case, the budget period would be over the 6-month period.
Representative Hudson. And maybe stay here, Mr. Johnson, because Representative Hudson may have a follow-up question.
I think that gives me the thumbnail
Okay.
sketch. You are looking at something and projecting forward. Okay.
And it sounds like, in a way, it is a slightly retrospective because it's past 30 days, but then it's seeing what changes may be coming. Okay, good. Yeah, thanks. And no other follow-up, Representative Hudson? No, okay. Representative Zalesnikar, looks like you maybe had another item. Yeah, Representative Zalesnikar.
No, I appreciate the information today because and to Representative Hicks, it may be that there's a gap of understanding. I don't know where it comes from. I only raise my questions, because I've had many workers say, especially through COVID, we want to work more shifts, but their perspective was they're losing everything. So I don't know where that's coming from. I'm all for eliminating some red tape to allow the county to be more efficient. I think the more efficient we are is going to help everybody be able to have a pathway back to independence and understand it. So thank you for your efforts to do that.
Sounds like maybe a rich conversation outside of committee about some of those topics. Thank you, Mr. Johnson. And so going to Lee Daniels as usual for comment or question. Lee Daniels.
Thank you, Chair Pinto. Well, my colleagues again have made some really good points. We kind of support the idea. Personally, I'm just not sure how this is going to incentivize people to be self-sufficient. I know there's guardrails and there's problems with, like Representative Zalesnikar said, on how many hours they can work. And it's a long program. It's I believe it was 60 months total. So I've been working for a long time on welfare reform, and I think I've got an idea that might help smoothen all this out and get people working faster with a scalable payment plan for your insurance and such, and daycare if needed. But I do support the premise, and I think we had a pretty good discussion today, and I look forward to further conversations on this idea.
Thank you, Lee Daniels. And I should note for members, you'll note there's not a fiscal note at this time. That's going to be coming after the budget forecast, and then the bill is being laid over. And so by the time we're making our budgetary decisions, we'll have a sense of that. Mr. Berg, is there anything that I'm missing in what I just said? Nope. Good. I'm all right. Mr. Berg is endorsing that. And so we'll go to the bill's author. And I should know how lucky we are to have the expertise of Chair Knorr here. And perhaps, Chair Knorr, if you're willing, you could also comment a little bit on Lee Daniels' point about saying, not sure how this does get to self-sufficiency. But Chair Knorr, please.
Thank you, Mr. Chair, and members, for the conversation. This bill actually essentially creates simplification, and also removes the burden, including the 6 months reporting, whereby it serves the purpose of making sure that the individual who's seeking help, this is particularly families with children. Majority of the participants in the program are young children. So this is supporting families so that we can end that deep poverty. When we create these burdens for the workers, when we create these burdens for the individuals who are in crisis, we are not serving the purpose of the cash assistance program or any program that we administer. Mr. Chair and members, I think this is a great bill that is going to solve a lot of problems, not only for the counties, but for the state, and also reduces the burden in how we administer those programs. I'll ask for your support in the end. Thank you so much, Mr. Chairman.
Thank you, Chair Knorr. Thanks for bringing it to us. And with that, the chair lays over House File 466 for possible inclusion in a budget bill. And again, grateful to have you here, Chair Knorr, and thanks to the testifiers both for your testimony today and to each of you for your work on behalf of the community.